Cecilia Sorensen, MD, is an emergency medicine physician-investigator in the area of climate change and health at the UC School of Medicine and School of Public Health. Long-term energy projections say global energy consumption will increase 20 to 35% relative to 2018 levels, showing an urgent need to increase policy efforts to help decarbonize the energy sector to avoid increasing apparent negative impacts on human health. Translating this research into policy in order to build resilience in vulnerable communities is the focus of her work. As a founding member of the Colorado chapter of PSR, a member of the Colorado Consortium for Climate Change, a scientific advisor for the Citizens Climate Lobby, and the course director for the nation's first medical school course on climate change and human health at University of Colorado, she also has a postgraduate fellowship to train clinician leaders in climate and health policy. If you have questions during her presentation, please go to the Q&A box, mention her, and ask your question. And now, Dr. Sorensen.
Hi everyone, it's great to be here today. My name is Cecilia Sorensen, and I'm going to be talking about the impacts of fracking emissions on global climate change and human health. I have no financial disclosures or commercial interests to declare. So I want to start out by saying that we are truly living in unprecedented times in Earth's history. It's said that we are the first generation to feel the impacts of climate change and the last generation that can do anything about it. Over the past 50 years, which is a very short time in geologic history, we've seen a rapid and drastic rise in atmospheric CO2 levels, which is leading to instability in our climate and ecosystems. However, simultaneously, there's been a drastic rise in methane concentration in the atmosphere. Now, while carbon dioxide deservingly gets a bad rap when it comes to climate change, methane actually accounts for between 25 to 40% of global warming. So when you compare methane and CO2, they're not equal in terms of their warming potential due to their chemical structure. So in order to compare the two, scientists have created a metric which is called the global warming potential, where CO2 is assigned a value of 1. Now for methane, it depends on the time frame you analyze. Methane has a half-life of roughly 9 years in the atmosphere. So during the first 20 years, it traps roughly 86 times the radiative energy as does CO2. However, when you average the impact of methane over 100 years, its global warming potential is diluted to 34. Now, this is very important because policymakers typically ignore methane's warming potential over 20 years when assembling a nation's emissions inventory. Instead, they stretch out methane's warming impacts over 100 years, which makes the gas appear more benign than it actually is. And this is a big problem because it allows nations such as the US to use a lot of natural gas and meanwhile present a clean energy facade to the world. Now, if we look closely at this graph of methane concentration, we see a gradually tapering off of methane emissions between 2000 and 2005, and then we see the curve escalate in the past 2 decades, actually increase nearly 10% from prior decades. The question here is, where is this methane coming from? We know methane is released by many natural processes as well as livestock production. However, recent emerging research shows that much of this increase over the past 15 years is linked to fracking in North America. This is because, in addition to leaking VOCs, fracking also releases large amounts of methane, and this happens during nearly every phase of the natural gas supply chain. Now, the rate of methane leakage is highly politicized and highly controversial because, first of all, it is difficult to measure with current technology, and second, because emissions vary greatly between wells and between phases of the supply chain, results from one site may not necessarily produce a valid assessment for a different site, even within the same geographical region. However, despite these limitations, estimates have been made. So there was a review in 2016 where they looked at all the different studies which tried to measure methane leaks and found that across the supply chain, the methane leaks range from 0.2 to 10%. However, the most recent study estimates that average leakage rates are even as high as 12%. And this is a very important number that I want you to remember. So natural gas has been touted as a bridge fuel and advertised as a cleaner alternative to coal. However, it's estimated that the climate benefit of switching from a coal-fired to a gas-fired power plant can only be achieved if total natural gas leakage is below a threshold of 3.2%. Now, unfortunately, early in the fracking boom, the EPA estimated that leaks were less than 1.2%. So this myth has been propagated, but as we know, leaks are probably closer to around 12%. So the argument to switch to natural gas, at least from the climate perspective, is not valid. In fact, recent studies have looked at this and concluded that the substitution of gas for coal has actually increased rather than decreased global warming for many decades, and that compared to coal, the footprint of shale has a comparable footprint to coal on the 100-year time frame. So natural gas really isn't doing us any favors. The other issue with claiming that natural gas is a bridge fuel is that new natural gas power plants are built to operate for 40 years. So this investment in infrastructure really isn't set up as a bridge, it's set up to extend our usage of fossil fuels. And furthermore, by expanding our use of natural gas, we reduce the market for renewable energy resources and ultimately delay the transition so dearly needed. So let's change gears and talk about the impacts of climate change on human health. So when it comes to climate change, clearly all forms of life on this planet are affected. However, human health is a powerful frame to bring the threats of climate change from the far off lands to the here and now conversation, because nearly everyone has had an experience of poor health. Additionally, health transcends ordinary political boundaries and hopefully provides a common ground for communication and action. So recently, the Lancet published a special series arguing that climate change is the greatest health threat of the 21st century, while at the same time, they argued that tackling climate change could be the greatest global health opportunity of the 21st century for the very reason that climate change transcends nearly every aspect of health. So just as an overview, this schematic from the Lancet is demonstrating how increased greenhouse gases are generating what they are calling climate pressures, which includes increased temperatures, more extreme weather, rising sea levels, and extremes of precipitation. And these in turn lead to exposure pathways, which include extreme heat, air pollution, water contamination, changes in vector ecology, decreased food security, and population displacement. And these exposures have broad impacts on health, for example, leading to adverse birth outcomes, respiratory disease, malnutrition, diarrheal disease, heat-related illness, and poor mental health. Now, a theme that will come up again and again is that climate change affects everyone, but not equally. So the great tragedy of climate change is that those who are most affected tend to be those who, first of all, contribute least to the problem, as well as those who are victims of structural discrimination or of underlying socioeconomic or health-related vulnerabilities. So I'd like to give a few examples of the impacts of climate change on health. Now, when it comes to heat, we've been seeing a gradual but consistent rise in temperatures. Here we're looking at the distribution in temperature in the Northern Hemisphere for the reference period, which is 1951 to 1980. And as time goes by, we see the bell curve of temperatures shifting left and flattening out, meaning we're seeing higher average temperatures, but also more extreme temperatures. And here we're seeing the current decade, where formerly anomalous high temperatures are becoming the norm. And all of these temperature changes have broad impacts on health. So we're all familiar with heat illness, and that includes things like heat stress and heat stroke. But in addition to this, heat actually worsens cardiovascular disease and respiratory disease, and additionally increases the risk of kidney failure. It's also been found to be associated with interpersonal violence, as well as assault and accidental trauma. We also see increases in pregnancy complications in response to heat. Now, it's important to note that the threshold at which increases in temperature cause harm to an individual depends on many factors, including pre-existing health conditions and acclimatization. So heat illness is really a disease of vulnerability, and for some, even small rises in temperature can have tremendous health implications. So how and why does heat cause so many problems? Well, physiologically, heat activates inflammatory pathways throughout our body, and it alters clotting cascades, and additionally alters the way our brains control our heart. And this can result in cardiovascular and cerebrovascular events, such as arrhythmias, heart attacks, and strokes. Heat is also especially dangerous for patients taking any medications which interfere with fluid balance, such as beta blockers and diuretics, as well as any medications which interfere with central thermoregulatory centers, such as SSRIs and antipsychotics. And heat, in addition to affecting health, threatens the socioeconomic well-being of societies. In the US, we know that labor productivity is decreasing due to extreme heat. US workers, especially in agriculture and industry, lost nearly 1.1 billion hours between 2000 and 2018, and 65 million potential hours in 2018 alone from extreme heat. We find that decreased productivity is often the first sign of health harms from heat. And all that extra heat has to go somewhere. It doesn't just stay in the ambient air, and it actually gets absorbed by oceans. So 93% of it actually is stored in all the oceans and freshwater bodies on the planet. And what we see is a rise in global ocean heat content, with nearly half of the increase occurring in the past 20 years. And this is the warming that fuels more powerful storms, as well as more heavy precipitation. So much so that there's actually a measurable rise in the frequency and intensity of extreme precipitation events, which has huge impacts on our water supply. So for example, in the US, we observe that extreme precipitation correlates with increased healthcare utilization, especially among children and the elderly. In fact, more than 2/3 of recent large waterborne disease outbreaks in the US have been preceded by extreme precipitation events. And this is bad, it affects our health. But when these events occur in developing parts of the world with poor or non-existent wastewater management and an under-resourced healthcare system, the impacts are devastating and deadly, especially among children under the age of 5, in whom diarrheal illness is still a leading cause of death. Hazards to health also arise from ocean warming. For example, there's been an increase in all types of Vibrio infections over the past 30 years, which is linked to this warming. The most famous type of Vibrio is cholera. However, there are many subspecies which cause gastrointestinal illness as well as wound infections. Warm sea surface temperatures are also linked to the outbreak of harmful algal blooms, which threaten the safety of seafood. And this affects health as well as the livelihoods of coastal communities. The excess heat is additionally fueling more intense hurricanes. So as we saw with Hurricane Harvey, the ocean temperature in the Gulf of Mexico was 7 degrees hotter than normal when the hurricane approached southern Texas. And as a result, when the hurricane hit Houston, the amount of rainfall over 5 days was so extreme that it made it a 1 in 25,000 year event. In some nearby areas, it was a 1 in 500,000 year event. And as we talked about before, these events, these formerly anomalous events, are becoming more common. And the health impacts of powerful hurricanes are enormous, as Hurricane Maria demonstrated in Puerto Rico. The hurricane completely destroyed the island's power grid and communication networks, and the majority of the island's 69 hospitals were without electricity or fuel for generators. Critical shortages of essential medications quickly ensued. Staff couldn't get to hospitals because the roads were impassable, and many residents couldn't access medical care or have access to their medications. Now, simultaneously, we saw outbreaks of rare infectious diseases such as leptospirosis as a result of residents drinking untreated water out of springs. Now, although extreme weather events occur in localized geographic areas, the effects are far-reaching. So as we can see from this graph of displaced survivors from Hurricane Maria, this is all based off of FEMA data, this represents tens and thousands of displaced people who had to flee Puerto Rico and establish a new home and a livelihood in a different location. And when people lose access to their primary healthcare systems, they lose access to their medications, to their continuity of care, and it's associated with poor health outcomes. Now, according to insurance companies who closely monitor disaster claims, the incidence of disasters has been steadily increasing over the past decade. What we notice from this graph is that the rate of geophysical events, which is the red in the bottom, these include earthquakes and tsunamis, has remained relatively constant over time. However, climate-linked disasters, such as meteorological events and hydrologic events, as well as extreme events, such as heat waves, droughts, and wildfires, are all increasing. And so I just pulled this data from the Global Internal Displacement Monitoring Center, which carefully monitors those forced from their homes due to disasters or conflict. So in the US, there were nearly 1 million people forced from their homes in just 2019 alone due to disasters. And as I mentioned, disasters have huge impacts on people's health, including loss of medical care, mental health impacts, job loss, and more. Now, globally, the numbers are even more staggering. So in 2018, a total of 28 million new displacements were recorded, and 17 million were due to disasters. Now, if we look closely, I know this is small type, but what we can see is that the largest new displacement events in 2019 are all due to climate-related events, such as storms and flooding. Now, shifting gears, let's talk about air quality. So the burning and extraction of fossil fuels, we know releases VOCs, as well as nitrogen oxides, which in the presence of heat and UV radiation form ozone. Fracking also releases a large amount of fine particulate matter. Worldwide, air pollution, much of a result of fossil fuel extraction, kills 9 million people every year, with many of these deaths occurring in the United States. So although we're a high-income country, we still have a huge problem with ambient air pollution. Additionally, the massive and unprecedented wildfire seasons, which have been fueled by climate change, are also contributing in a large part due to our poor air quality. Now, physiologically, ozone and fine particulate matter enter our lungs, where they cause inflammation of our lung tissue, and particles less than 2.5 micrometers actually can enter our bloodstream, where they cause inflammation and injury to blood vessels. And when that happens, we see as atherosclerosis and other small vessel diseases become more rapid. Exposure to poor air quality has also been shown to cause asthma in children, as well as worsen chronic respiratory disease in adults, and contribute to heart disease, as well as premature mortality. And so, of course, we see that poor air quality is associated with increased ED utilization for a broad range of respiratory and cardiovascular conditions. And this is all very expensive. So the healthcare costs attributed to poor air quality alone are estimated at $21 billion annually, and that's just in the US. There's also emerging links between coronavirus and air pollution. So a recent study of roughly 3,000 counties in the United States by researchers at Harvard Public Health found that higher levels of PM 2.5, which is the really small fine particulate matter, were associated with higher death rates from COVID-19, which provides evidence that counties that have more polluted air are going to experience more of a death toll from COVID-19. And so this is really an example of how climate change is a threat multiplier. It takes events that are bad to begin with, and it makes the impacts worse. Climate change is also altering ecologic conditions. These are things like humidity and temperature, which influence the distribution of diseases which are transmitted by vectors. And when I say vectors, I mean ticks, fleas, mosquitoes, anything that bites you or gets into you and transmits a disease. Now, it's important to appreciate that the relationship between vectors and human disease is complex. It's not, a one-to-one sort of relationship. It's mediated by behavioral factors, by demographic factors, as well as environmental factors. However, what we know is that because of climate change, we have permissive ecologic conditions, which are allowing vectors which carry human disease to expand their range into new habitats. Now, according to the CDC, between 2004 and 2016, there was a near tripling of vector-borne disease illnesses in the United States and US territories. While much of this is fueled by climate change, it's also being fueled by encroachment of human civilizations into wild ecosystems. And Lyme disease is sort of the poster child for this. It's transmitted by the Ixodes tick, and currently it's expanding its range, largely driven by warmer winters and more humidity. And we can see changes just over the past 5 years. Here we're looking at 2017 versus 2012. And here we're looking at the projected range of Lyme disease in 2005 versus 2080, where we're going to be seeing an expansion of Lyme habitat all the way up into Canada and moving far west into Nebraska and Kansas. Now, what you may have already gathered from the examples I just provided of the health burdens of climate change is that they are not equally distributed across the population. What we see is that those who are victims of inequality due to gender, age, structural racism, socioeconomic poverty, and disability suffer greater susceptibility, greater exposures to climate hazards, and are less able to cope with and recover from damages. And this results in a disproportionate loss of assets and greater inequality. So to give some examples, a recent review of census information on the effects of natural disasters across 140 countries showed that although disasters create hardship for everyone, on average they kill more women than men. For example, in 1991, when cyclones in Bangladesh killed 140,000 people, 90% of the victims were women. And in 2008, when Cyclone Nargis hit Myanmar, 61% of the 130,000 deaths were among women. Additionally, female survivors suffer disproportionate decreases in life expectancy, and women are also at higher risk than men from suffering from mood disorders such as PTSD and depression in the aftermath of disasters, which impairs their ability to recover. Children are another highly vulnerable demographic, and the World Health Organization estimates that nearly 88% of the health burden as a result of climate change may occur in children. This is because climate impacts health at all stages of development, and health impacts early in life are amplified throughout the life of a child. So I just presented many examples showing how devastating climate change can be on human health and how fracking, through the production of methane and particulate matter, is driving these impacts. However, I want to point out that we still have time to change our course. In 2018, the IPCC reported that in order to avoid catastrophic climatic changes, the world needs to limit warming to 1.5 degrees Celsius, which would require global emissions of CO2 to fall by roughly 45% by 2030, reaching net zero around 2050. Now, what we've seen is that global fossil fuel emissions and CO2 emissions have increased by 6.4% annually, and the world population is expected to grow in the years to come. So we have a lot of work to do, but I believe there's reason to hope. If you look at the stock market returns in the energy sector, the increases have been among clean energy companies, while the value of fossil fuel companies is dropping. For example, here is the overall value of ExxonMobil in the red, and here's the value of Tesla just surpassing that of ExxonMobil. There are now 5 times as many jobs in the US in solar as in coal mining. And the storage capacity for renewable energy is increasing nearly exponentially, which makes it possible for us to use solar energy and wind energy even after the sun has gone down or the wind has stopped blowing for the day or night. So this is very encouraging. Simultaneously, battery prices continue to go down, and that's one of the reasons why these changes have been so dramatic. And here we see a list of countries that are planning fossil fuel vehicle phase-outs, and this is as of July 2019. The trend is already underway, and it's going to accelerate, and it's being driven by laws that are being passed in countries like these that require the phase-out of all gasoline and diesel vehicles, and this is also very encouraging. California also just passed a law banning the sale of new gasoline cars as of 2035, which hopefully will signal other states to do the same and put car manufacturers on the course towards electric. Additionally, 112 global financial institutions have announced that they will stop financing coal-fired power plants. And that's a big step in terms of preventing more development. And we've been witnessing the consumption of coal going down, especially this year. What we're seeing is that the consumption of renewable energy is going up at the same time, and experts predict that global coal demand will fall by about 8% in 2020, which is the largest drop since World War II. Medical societies are also increasingly becoming more engaged in this issue. The American Medical Association recently passed a resolution to divest from fossil fuels, and many other societies are following suit. However, we still have an uphill battle to fight. Taxpayers around the world are being forced to subsidize fossil fuel energy, as you are aware, and this includes subsidies going to fracking, and this is happening at a ridiculous rate. Now, if we look at this graph, imagine what would happen if these subsidies were actually directed towards renewables. Now, in terms of methane regulation, the federal government has implemented numerous laws to limit methane emissions, but it is clear that they are not working as effectively as one thought, and current political trends are not actually progressing towards stronger oversight. So in 2016, the EPA adapted the new source performance standards to aid in the reduction of VOCs and methane emissions. However, under a recent executive order from the Trump administration, these regulations have been reversed, despite actually protests from fossil fuel companies. Under the order, the new EPA has now stopped the requirement to regulate methane emissions, while also decreasing the frequency with which companies need to check for and repair any methane leaks. However, states also have the ability to regulate independently from the federal government, and Colorado has been a leader in this effort. So in 2014, Colorado became the first state in the nation to regulate the industry's methane production. Part of this program included semi-annual leak detection and repair for low-producing wells, stronger tank controls for low-producing wells, expansion of a find and fix program for malfunctioning controllers, and a requirement that operators calculate and report on all pollution, including methane emissions. So although this is a step in the right direction, more definitely needs to be done. We've seen issues in reporting accuracy, technological limits in our ability to monitor leaks, as well as financial limitations in the state's ability to accurately monitor levels. So until we have better oversight, we won't know if these regulations are doing what they're intended to do. So we need to be following these issues very closely. I'd like to leave you with a few summary closing remarks. First of all, is that fracking emits a large amount of methane and greatly contributes to climate change. Natural gas is not better than the climate than coal is. Climate change has broad impacts on the health of all Americans, and it stands to worsen current health inequalities, especially for the most vulnerable citizens. However, changes are happening in the energy sphere, and we are beginning to see a transition. But we continue to need monstrous amounts of political will in order to see continued change. So I am hopeful. Thank you so much for your attention.